Hello, Enzo, and congratulations on your new baby. I'm going to be providing you with some discharge teaching regarding maternal and newborn care. First, I'm going to start with maternal care. In regards to your diet, you want to maintain adequate nutrition as it is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which would include dark green leafy vegetables, milk, and yogurt. Drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. For activity, you want to gradually increase your daily activities until you're back to your normal routine. Rest frequently and do not lift, push, or pull for the first 2 to 6 weeks, or as instructed by your physician. Do not drive until you're released by your physician. For breast care, you may notice your breasts and nipples have changed and or grown in size during your pregnancy. Wear a well-fitted, supportive bra day and night, and it may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. Leaking may occur for several weeks to months, and you may apply ice packs between feedings to ease discomfort. If you do not choose to breastfeed, you still want to wear a well-fitted supportive bra for at least 3 to 4 days following delivery. Refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle, and this will alleviate your engorgement. Apply cold compresses in the form of a frozen wet towel, cold packs, or ice packs for 15 minutes at a time, every hour as needed. To prevent tissue injury, do not apply cold directly to bare skin. Do not massage or apply heat to the breasts. If you do choose to breastfeed, here are some tips. Your baby's mouth should form a tight seal. The lip should be against the areola, not the nipple. If the baby is suckling incorrectly, slide a finger between your baby's lips and your breast to break the suction gently. Reposition and try again. How long should you nurse? It's as long as your baby wants. It's usually about 10 to 30 minutes. At first, your newborn will probably want to nurse as many times in a 24-hour period, though not for very long. It is important for the health of your breasts to have your infant feed from both breasts every feeding. Good signs of nursing will indicate hearing your baby swallow without a clicking sound, seeing movement above the baby's ears, and not seeing dimples in your baby's cheeks. You and your baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it may mean the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. As far as hygiene goes, you want to wash your hands frequently as you are caring for yourself. This will prevent infection, and you want to make sure you always wipe front to back after going to the bathroom and clean your bottom with warm tap water using the Peri bottle. After you urinate or have a bowel movement, it is important to change your pad frequently. Vaginal bleeding will decrease in amount from bright red to pinkish or brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. You want to avoid constipation, so you may take a mild laxative or stool softener until bowel movements have returned to normal. Increase fluid and fiber in your diet. You want to discuss birth control options with your healthcare provider, and you may choose to obtain a method of birth control before resuming sexual intercourse. As far as sexual activity, nothing should go in the vagina for the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman feels physically and emotionally ready. Here are some warning signs to report to your healthcare provider immediately. Pain, redness, warmth, swelling, drainage, or foul-smelling discharge from the incision, or if the incision begins to open. Perineal laceration, this is involving your perineal laceration or your C-section incision. If you have any discharge from the vagina that has a bad odor, if you have a severe headache or blurred vision or visual changes, if you have a temperature over 100.4, or you feel cold and feverish and have the chills. If you have any thoughts of harming yourself or your baby, pain or burning sensation, redness, warmth, or swelling in the legs. Any breasts that are painful, swollen, hot, tight, itchy, or have some sore spots with redness or red streaks and flu-like symptoms. sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness, or faintness, crying spells or mood swings that feel out of control, if you're unable to empty your bladder, or urination that is painful, difficult, or too frequent, if you have any difficulty having a bowel movement. If you need to report domestic violence or abuse, call 1-800-96-ABUSE. As far as care for the infant, we'll go over some safety. For sleeping, you want to place your infant on his or her back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parents, but not in the same bed. Avoid covering the infant's head or overheating. If you're going to use a bulb syringe, keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe well with warm soapy water after each use and allow to air dry. Wash your hands prior to handling the neonate. Remember that all infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. At home, the use of outdoor announcements is not recommended to announce the birth of the baby because they call attention to the presence of a new infant at home. Question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risks of SIDS. As far as some behaviors, crying is a normal response for your infant. The most likely causes of crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. Calming techniques include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, giving your baby a pacifier. But remember, it is never okay to shake your infant. If you get frustrated or angry, just put your infant in a safe place, take a break, and call a friend. Remember that infants require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding, and you should place your baby on his or her tummy each day for supervised tummy time. This will strengthen his or her neck and abdomen. As far as diet goes for the infant, if you're breastfeeding, your infant should breastfeed 8 to 10 times a day per infant cues. Be sure to hold your infant close to you while feeding. Your infant needs to be cuddled and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. If you're doing formula feeding, your neonate is receiving Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses the feeding, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. As far as positioning goes, be sure to hold your infant close to you while feeding. Your infant needs to be cuddled. Never prop your infant's bottle up to feed. Infants need to be burped every half ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing the back to burp. For newborns, newborn rash is normal for your infant to develop. It appears with small red circular areas with a white dot in the middle. This does not require treatment and will generally resolve within the first few weeks of life. You want to avoid any lotions, powders, or perfume soaps. Remember that milia are the pearly white bumps usually on the face and especially on the nose, and they will disappear within the first week of life. Jaundice is also a common occurrence in newborns. Your infant may appear to have a yellow coloring to his or her skin. It will start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours, then you need to call your healthcare provider immediately. As far as infant care goes in regards to bathing, your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water and gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area from last. Mild infant-type soap may be used on your infant's body. You want to keep the umbilical cord clean and dry. Cleanse it with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes, and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within the first 2 weeks of life. Moving on to diapers. 1 to 2 wet diapers are normal for the first day or two of life, and then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least 2 bowel movements every 24 hours, and you may want to keep a record of your infant's wet and dry diapers to monitor adequate elimination and hydration. On inspecting the genitalia, if your baby is a female, always wipe the baby from front to back, and be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and place the diaper. It is normal for the baby girls to have white or pinkish discharge. These secretions are normal and will gradually disappear. If you have a male who is uncircumcised, always wipe the baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash, and pat to dry. If you have a male who is circumcised, always wipe the baby from front to back as well. Be sure to cleanse all creases and folds to prevent diaper rash, and pat to dry. Vaseline gauze will be applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially, and then will change to have a yellowish sticky film. This is very normal. If you see any bright red bleeding or green drainage, then you should contact your healthcare provider. The plastic ring method of circumcision does not require a dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green drainage, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad in plain water. Dress your infants as you would yourself. Avoid overdressing your infant. Too much clothing and too many blankets may cause your baby to become overheated. Infants should receive all recommended vaccinations. Some warning signs that you would want to report to your healthcare provider immediately. These are things you want to watch for. Some general warning signs with newborns would include, but are not limited to, no urine in the first 24 hours at home. This can be difficult to assess, especially with disposable diapers. No bowel movement in the first 48 hours. A rectal temperature of over 100.4 degrees Fahrenheit or 38 degrees Celsius, or a temperature of less than 97.5 degrees Fahrenheit, 36.5 degrees Celsius. A rapid breathing rate over 60 per minute, or a blue coloring that does not go away. Newborns will normally have irregular respiration, so you need to count for a full minute. There should be no pauses longer than about 10 seconds between breaths. Any retractions or pulling in of the ribs with respirations, wheezing, grunting, or whistling sounds while breathing, odor, drainage, or bleeding from the umbilical cord, yellow coloring of the eyes, chest, or extremities, crying, irritability, or twitching that does not improve with cuddling and comfort, a sleepy baby who cannot be awakened enough to nurse or nipple, any signs of sickness, for example, cough, diarrhea, or pale color. The baby's appetite or suck becomes poor or weak. If you see any of the above signs and symptoms, be sure to call your doctor. Congratulations on your new baby, and if you have any further questions, don't hesitate to reach out. Yay!